This webinar contains audio descriptions for the blind and visually impaired.
Our first topic today will be reinvestment of funds, which will be presented by David Buck and Dr. Carrie Sequeira with the California Department of Education. I will pass it over to David now.
Good afternoon. My name is David Buck. I'm an educational fiscal consultant with the Office of School-Based Health Programs at CDE, and Carrie Sequeira and myself will be discussing the Office of School-Based Health Program, the LEA BOP overview, with emphasis on reinvestment. I'll let Carrie introduce herself, and then I'll go back to presenting the first few slides.
Hello and good afternoon, everyone. So my name is Carrie Sequeira, and I have the honor and privilege of being the administrator that oversees the Office of School-Based Health Programs, which is charged with the mental, behavioral, social, emotional, and physical health of our 6 million students in California by offering technical assistance, resources, support, and ed code and statutes around how best we can support them. It's a pleasure sharing space with all of you. Prior to this, I was a high school principal for many years, and I just really appreciate your time today. Go ahead, David.
So for this part of the presentation, we'll be first giving an overview of the LEA BOP reinvestment, and then be giving a guidance on some sampling of reinvestment questions. So an overview of the reinvestment. Please reference the California Education Code 8804,
which talks specifically about reinvestment of funds, EC Section 8804, subsection G. The slide also reads, "For the purposes of this chapter, support services shall include case-managed health, mental health, social, and academic support services benefiting children and their families."
And this includes support services, which include, among others, health care, including immunizations, vision,
and hearing testing and services.
Dental, physical exams.
It includes physical examinations, diagnostic, and referral services.
And prenatal care. Also, mental health services, including primary prevention, crisis intervention, assessments, referrals, and training for teachers in the detection of mental health problems. Also, substance abuse prevention and treatment, family support,
and parenting education, including child abuse prevention and school-age parenting programs.
Academic support services,
including tutoring, mentoring, employment, and community service internships, and in-service training for teachers and administrators.
And with academic support services, I'll let you all read the slide, but keep in mind that these are used to supplement, not supplant, existing resources in these areas. And I'll give you half a minute here to read the rest of the slide. And again, this is coming a verbatim from the Education Code. Also covered is counseling, including family counseling and suicide prevention, services and counseling for children who experience violence
in their communities,
nutrition services, youth development services,
including tutoring, mentoring, recreation, career development, and job placement,
case management services, and provision of on-site Medi-Cal eligibility workers. And lastly, the information from our legal that we would like to give to all the LEAs is that the CDE does not approve or deny individual requests for allowable expenditures. If an LEA questions if an expenditure is a permissible use of funds, the CDE encourages LEAs to consult with the agency's legal counsel. And then the rest of the slide has a little bit more information.
The slide continues. Below you will find a couple of resources regarding reinvestment of funds. Our partners at California School-Based Health Alliance, 2017-Hansing-Services-Students-California-LEAs.pdf and California Code EDC 8804.
I'll put in the chat the general language that we use if there's at all any question about if a particular service is reimbursable or not. We'll go over some specific examples and address those, and then we'll kind of see kind of how much in the weeds that the LEAs have in terms of additional questions or information that they put in the chat. So this is the first slide of a sampling of reinvestment questions that some of the LEAs had submitted to DHGS, and we'll be answering some of those with a specific yes or no, and others, again, asking the LEAs to refer to your LEA legal counsel. Carrie, do you want to go ahead and address the first question here?
Of course. And I see Rebecca has a question in the chat. Can you go back to the slide with number 1 for reinvestment? I don't have access to the slide deck, but I think the slide deck has been shared with everyone, if I'm correct on that, Sarah. Yeah, so if you that might be the best use of time. And if we can go into the questions that were previously submitted, and I also want to make sure that we're able to answer any questions in the chat as well, that might be the best use of time. Is that okay, Sarah? Okay, so the first question was, are we allowed to utilize Medi-Cal funds to pay for a contractor or contracted services, such as contracting an individual to conduct assessment? Yes, that is an allowable use of a reinvestment of funds. May LEA use LEA BOP reimbursements to send their admin assistant to the National Alliance for Medicaid and Education Conference? Would this be an appropriate use of funds? The admin oversees the LEA BOP program for the district and will be using the knowledge she gains at the conference to better support the LEAs with the running of their program. Yes, that is also an allowable expense. And very specific, and we wanted to highlight that as an example of an allowable expense. Okay, this is actually statewide. So a district's having trouble finding special education teachers. They're wondering if they can use the reimbursement to help pay for a third-party company to assist them in finding SPED teachers. Would they be able to use LEA BOP monies?
The question continues. Would they be able to use LEA BOP monies for this, since the need to hire SPED teachers is what would allow for students to be served and IEPs to be held?
Yes, this is an allowable use of the reinvestment of funds. Okay, are LEA BOP funds able to be reinvested into transportation? That actually is called out in Ed Code, and transportation support for students and families. So as the families is going to be a gray area, and I would definitely want you to talk with your own LEA BOP committees. But as far as for students, it is an allowable use of a reinvestment of funds. It doesn't specifically state for families in Ed Code. Okay, so being a former high school principal and knowing how important golf carts are, I have that lens as well, right? Especially if you're in a very large campus. So in the way this question was worded, our district wants to purchase batteries for our golf carts. These carts are used in part to transport ill or injured students and are vital to the workings of the school sites. There are no funds budgeted for this purpose. Each battery is approximately $2,700. School sites are struggling to find the money needed to keep the carts running. Would this be considered an appropriate use of funds? Oh, it says from DHCS's perspective. I'll let you answer that, Sarah, but in CDEs, it is not an allowable use of reinvestment of funds. But I'm going to give you my lens on this. If you had a designated golf cart that was perhaps working in medically fragile, needed to be by a medically fragile classroom, and it was designated for that to support the needs of students with varying needs, that would be allowable. But just in general, a blanket, it would not be allowable expense. So replacing, I want to be very specific. So it would be an allowable expense for the batteries. The question was about the batteries. If there was, well, the high school I worked at, we had a classroom where we had a golf cart parked right outside of it because there was a lot of seizure activity and different things going on, and we had to have that one always running. That would be allowable. Can medical dollar fees purchase student reinforcement? So we received several questions on that. So gift cards, T-shirts, buying stuffed animals, Those are not, that is considered a gift of public funds whenever there is that where they take it away from the school. And I'll go a little bit deeper about, I think we talked about comfort cups in a later slide, but just in general, to hand a student a gift card, Medi-Cal funds would not be an appropriate use of funds. Athletic training supplies, we like to spend our reimbursement funds on supplies that our athletic trainer used to treat students, such as...
The full question reads, are there any policies against investing our funds into our athletic training supplies? We would like to spend our funds on supplies that our athletic trainer uses to prep/treat students, such as bandages, tape, ice packs, flex wrap, etc.
No, this is not an allowable use of reinvestment of funds in the CDE lens. Teachers requesting Medi-Cal reimbursement funds for a student who needs orthodontic surgery for a severe overbite.
The question continues. The parent asserts this dental procedure will have a direct impact on his intelligibility and progress in speech. Is this something we can spend these funds on? If not, can you please provide an explanation I can give to the parents?
No, this is not an allowable use of reinvestment of funds for a single student in regards to seeking that type of treatment. Yeah, Pamela, that's a great question. I was talking with Sarah about it when we were talking about FT and using reinvestment of funds for FTE, which I'll talk about, I think, in the next couple slides, is that because of attrition, students leaving, because of you're doing speech therapy and a student's absent for 2 weeks, you're not going to get the same amount every single month. So that would be something you would have to talk with your LEA about, because if the funds are not the same amount each month and you're allocating funds accordingly, it would have to be a hit to the general fund. So that would have to be an LEA's decision on that. Comfort cups for the students attending a wellness workshop that they could take them home? No.
The full question reads, may a district use their LEA BOP reinvestment funds to purchase comfort cubs for the students attending a wellness workshop for social and emotional help? Being that they can take the cubs home after the workshop is done, would that be considered a gift of public funds?
That is considered a gift of public funds. Now, with that being said, David and I had the pleasure of visiting a San Francisco Unified School District, a few of the wellness centers. Now, if you have comfort cubs that I'm not even sure what a comfort cub is, so I apologize. I'll do some research on it. But if you had like stuffies in there in the wellness center that stayed to help soothe the emotional well-being of students, that would be fine. But gifting them is not.
The slide states, if the comfort cubs were to stay on school campus, then it would be an allowable use of reinvestment funds.
Okay, this one was a really, I would definitely refer you to your legal counsel, but the question was, can they use funds, an LEA use funds to fund a charter that does not do billing for LEA Medi-Cal BOP or serve students regarding that?
The full question reads, can an LEA use LEA BOP funds to support one of their charters even though they do not bill as a consortium for LEA BOP? The charter does not participate in LEA BOP.
In my opinion, it is a misuse of the funds, but please feel free to go to your legal counsel and they may have a different perspective on that. Okay, if district SLP.
SLP stands for speech language pathologist.
An SLP, since they're billing for Medi-Cal, what percentage of the total funds collectively the district can be allocated to that department? We don't make that determination. It's not in statute. It's not in ed code. That is an LEA decision. So I would definitely work with your LEA regarding that.
The slide states, this is an individual decision at the district level on how they allocate funds. There is no EC about percentages.
When they build their LCAP out and their budget and everything else and their priorities, that'd be something you'd want to discuss with your LEA. Okay, so we have a program manager whose job is 100% dedicated to the operation of the LEA BOP. We would like to fund 100% of her salary through the Medi-Cal reimbursement received. If not 100%, is there a maximum and percentage allowable? Is this an acceptable use of funds? Yes, this is an acceptable use of funds, but it still would be something you'd want to discuss with your LEA because, as I shared, like through attrition, absences, just how things happen, they may not receive the same amount. You may not receive the same amount or warrant each month. So the district would have to be willing, if there was a deficit, that they had allocation in their general fund to cover such deficit. So yes, it is allowable, but it's definitely something you'd want to discuss with your LEA. To purchase a van with a wheelchair lift to transport severely handicapped students to and from students who are severely handicapped, and from various programs throughout the county, such as workability. We'd like to use the bed.
The question continues. We would like to use LEA BOP funds to purchase this van, as the purchase of this van will directly benefit students.
Yes, this is an allowable use of reinvestment of funds, but it would be a district decision. Just because CDE says it's allowable use, it may not be a priority for the district when they're building their LCAP out. So definitely refer back to your district. Can I hire someone to do academic support services, nutrition services, dental services, mental health services, to pay them out of it, and to add supplemental services, not supplant?
The full question reads, can I hire someone to do academic support services, nutrition services, dental services, and mental health services, and pay them out of the reinvestment funds? I am looking to add supplemental services, not supplant the payment of existing services.
So academic support, nutrition, and mental health services are actually called out in Ed Code as an appropriate use of reinvestment of funds. But I would definitely encourage you to talk with your LEA about dental services. And maybe Sarah knows more on that, but from the CDE, I'm not really sure, Sarah, around that.
So with that, LEA BOP doesn't cover dental services. So I would strongly caution that you work with your legal team to see if this might be something that is applicable. And Medi-Cal does have dental coverage through Denti-Cal. So I would definitely I recommend caution in regards to that.
Yeah, so we haven't seen it. So when we went to in Oakland, we went to a wellness center. They had an outside person through a separate contract that was doing that, and it wasn't being done through reinvestment of funds. So yeah, I agree with Sarah. Do we look towards SELPA to provide student-specific items for services like OT?
OT stands for occupational therapy.
Or should the LEA provide those? We have used our LEA funds in the past, but are wanting to explore other options and share the financial obligation. I would definitely work with them. There's no statute or ed code around that saying that there must be a portion that COEs or SELPAs cover in regards to providing resources to the school community, but that's something you could definitely ask your leadership team if they could explore with the SELPA.
The slide states there is not EC around the determination of whether an item or service should be funded by the LEA or SELPA. It is recommended to work with your SELPA and legal counsel for guidance.
Okay, so this one I needed more information on. So I don't really, so they said we screen and nominate grant applications that are then reviewed by our SOUP and admin. Is there any additional guidance on the types of supplies material that can be purchased with grant funds?
In parentheses, beyond what is in EC 8804.
Our collaborative group is disagreeing on whether or not such items as, or not items such as t-shirts and prizes for groups or clubs funded by grants, food, and furniture for a school site should be allowed to be requested in the grant applications.
The question continues. Some in our collaborative argue that since these items become the property of the student or family and are taken off the LEA's property, these items cannot be funded by reinvestment funds.
So I couldn't answer this in good faith without seeing the grant application, the specifics around the grant application. So if you're asking in general, if there can be a reinvestment of funds to purchase food, t-shirts, prizes, that would be considered a gift of public funds with these fundings. They're pretty restricted. Now, as far as like furniture, I would be amiss. I would need to see the parameters of the grant. I'd have to see what it's stated in the grant. And I would definitely defer to your legal counsel on that. So, Sarah, I don't know DHCS, but for us, food, snacks, that's considered not an allowable expense. But are you familiar with it being allowable in DHCS's world?
No, I would agree with your assessment there.
Yeah. So, Allison, I'm sorry, I just saw your message. Can you fund a school psychologist out of LEA BOP funds? I would, it's similar to anytime you're funding FTE. If you do not have the same guaranteed amount every single month, you're going to get $20,000. I'm not even sure where you're located, but $20,000, that would be a decision you'd have to make with your LEA regarding that. So if you don't get that funding, is that something that they are able to cover with general funds? So that is definitely specific to your LEA. Some smaller districts would not. So it would be something you would want to explore with your LEA.
Am I correct, DHGS? These are for services already rendered. So this is like a reimbursement. If they use some other money to cover those expenses, this would in theory reimburse it. But this is not for future services. So it's a reimbursement of services that have already occurred. Am I correct on that?
So there's two funding sources with the LEA BOP. There is interim reimbursements, which are claims submitted throughout the fiscal year, and then there
Right.
is for some LEAs a chunk of money that they get after their audit is completed. In regards to this, it's these questions that we're getting. It's in regards to that money that they're getting from the audits, making sure that's then reinvested in their programs.
But for the money, when he said did they expire, the answer would be no, basically, because they're for services that have already occurred. So of course, the costs are already out there, so they're logically not going to expire. Is that kind of basically correct?
Yes, that's correct.
Yeah. Okay. Okay.
Thanks, David. And I see another question. I know we're out of time, but it says we have iPads that are used as AAC devices and they get sent home with students to use at home. That would be like, I'm assuming, sorry, Amanda, I'm assuming that you're talking about like when there's like Chromebooks, that's something they use at home, but they turn it back in, correct? Yeah, that in CDE's perspective, that would be an allowable use of funds. Sarah, do you have anything different from that?
No, I don't have anything.
Yeah. In addition, I'm going to drop our email addresses. That's the office. I'll just put it here, office.php@cde.ca.gov.
The Office of School-Based Health Programs email is osbhp@cde.ca.gov.
And then I'll give you mine. And then I'll give you David's.
Thank you. I was typing mine in.
Yeah, and please reach out to us whenever. We really are here to, we know what you guys are doing, and we know how much you're trying to support the students and maximizing your dollars, and we'll do our best to give you our guidance around it. There is guidance, there's ed code on it around it as well. I don't know if there's a handbook on it, but it's very general. It's when we get really specific in the weeds, we will do our best to answer it, but often or at times we may refer you to your own legal team to interpret it. But I appreciate all of you. I hope you have a wonderful, wonderful Wednesday. Take care.
Yes, thank you. And just FYI, if someone does reply via email or ask a question, probably put it on all three of those emails, because the first one is a general inbox, which we look at daily, but we want to make sure that we don't overlook a question. So feel free to send it to all three of those emails at the same time.
Awesome. Thank you so much, David and Dr. Carey. I would now like to go ahead and introduce Margie Bobby from Los Angeles Unified School District, who will be also presenting on the reinvestment of funds topic, but from an LEA perspective. So I will pass it over to Margie now.
Good afternoon, everyone. I'm Margie Bobby, and I am with Los Angeles Unified School District. I will be going over the process and the reinvestment that we do for the Medi-Cal reimbursement programs in our district. As you can see on the slide, we have a circle, which is some of how we make determinations of how we're going to reinvest our funds. They kind of go in a cycle. We look at services that can then be billed, that we get the reimbursement. Then we look at reinvestment, and can it be for providers, and then back again. It is not the only process that we do use, but it's more or less a guide for us. Okay, and this is a list of the services that we do bill for and the provider types that we bill for their services to give you an idea of what I just mentioned on providers and services and how we do the billing and hope to recycle it back into the district to support health services.
The lists read IEP/non-IEP services, assessments, audiology, counseling, hearing screenings, nursing services, occupational therapy, physical therapy, speech and language, transportation, vision screenings. Provider types: audiometrist, audiologist, healthcare assistants, credentialed social worker, credentialed speech therapist, licensed clinical social worker, licensed vocational nurses, occupational therapists, occupational therapy assistants, physical therapists, school psychologists, licensed speech therapists, speech and language pathology assistants.
Okay, so as everyone knows, on the PPA and the annual report, there is guidance that says that an LEA should form an LEA collaborative, and it is in the state mandate outlined in the provider participation agreement, and it should represent a diversity of stakeholders that votes on the reinvestment funds within school link support services.
In parentheses, supplement, not supplant.
So based on this, we do have a collaborative and we do have representatives from both in the district and partners. So we do have also a parent. We have a physician with the community-based organization, someone who works with the county. And internally, we have a UTLA rep, which is one of our unions, and we have a person from our related services, special ed, and our chief medical director. So they all get to review what the requests have been and then make a decision based on a quorum of how the funds are going to be reinvested. This is annually on some of the funds. So in order to help us in the district, we have developed some collaborative guidelines, and it is for the purpose of providing a structure and a process of how those grant proposals, and we call them grants because some of them are ongoing and some of them are year to year, as well as structuring the meetings and the reinvestments. We do meet multiple times a year with the collaborative board members. The grant proposals are reviewed and for approval by the collaborative board members during one of the LEA collaborative meetings. This is just to give you a picture of what our guidelines that we have developed. They were updated in October 2022, but as things evolve, we also go back and update the guidelines. And then also the grant request that is sent out annually to all of the groups so that they can submit their request for funds. And it is called an action plan where we do ask them specific questions of how, if they are providers, how will they use the providers for their types of services that they will be providing, as well as if it is outside of providers, what is it that they are going to use and how is that going to benefit the district? So to start off with, our funds in our district are considered general funds restricted. And because of that, the funds cannot just be used like general funds where they are reinvested into all general fund items. So we do use the term restricted in our district. And we do have an ongoing, which is our ongoing reimbursement, which is our interim reimbursement year to year. And we also have our settlement reimbursement, which is our cost report settlement. So based on that, right from the top of any reimbursement that we receive on our interim basis, up to 15% of that, and that this is written in our guidelines, meaning that off the top of the reimbursement, the money will be used to support the administration of and operations of the Medi-Cal programs in order to manage the billing and the cost reports and everything that comes with the program. So starting with the manager, and that of course is my position, and I oversee the billing operations for all LEUSD reimbursement programs, along with LEA BOP and S1 RMTS. That also includes our EPSDT services in our clinics, as well as our specialty DMH services. And now the newest one that's added is the CYBHI program. With that, I do have medical billers. I have 4 of them who actually create, submit, and reconcile claims and reimbursement for all the LAUSD reimbursement programs. They provide quality review of the service documentation for all the reimbursement programs. We do internal billing. We don't use a vendor. We have our own EHR. And so the medical billers are part of the operations piece. We also fund 50% of positions for Medi-Cal advisors. They do 50% of their work in our S1 RMTS program, and 50% of their salaries are covered for the LEA BOP program. They provide quality review of our LEA claims. They do our coding for our S1 RMTS and create the rosters and manage that part of the program for S1 RMTS. And they also liaison with special ed for service documentation requirements and issues. They do attend their staff meetings and bring back the information of any new and upcoming things that are happening, and then how are we then going to use that in our reimbursement programs? How are we going to manage it? Is there any impact to it? Okay, also part of our administration and operations is our transportation staff and buses. We do fund some staffing positions who actually gather and review the ridership data and submit that to our ITS staff, Information Technology Services, to upload the information into our electronic health record to then create the claims. They also maintain the ridership documentation for the claims and provide the financial data for the annual CRCS. Some of those transportation staff do participate in the SWAP program. And recently we were able, with our settlement dollars, we were able to provide funding for electric buses and charging stations that are used as specialized special education buses that are required for our transportation billing. So if you can get the idea that behind this, again, how do we reinvest money into programs and staff that can actually help us for reimbursement, and what other programs can they participate in? Also, part of our reimbursement goes into funding our electronic health record, where we pay for the master contract and the annual maintenance costs for that electronic health record. And also we support staff that are in the information technology services who help us to maintain and update the actual requirements for any new information that needs to be set up in our system, where it has to be maintained on the back end for the technology purposes. I also want to add that we do set aside, under the administration and operations funding, we do set aside travel costs for our staff internally to be able to travel to conferences, any kind of travel that is required for the specific program that is impacting us. We don't just attend like name and state meetings. We also attend other conferences that have information of value that we can bring back into our district. Okay, so in our branch, we do have student medical services, and these providers are actually assigned to our school-based health clinics. We own and operate about 14 school-based health clinics. And though we have nurse practitioners, we have about 15 or 16 that we fund that actually provide EPSDT services in the clinics. They provide the physical exams, they provide illness visits and enrollment immunizations for our students. And they also review and sign the service authorizations that are required for the LEA BOP claims, and they are also our ORPs for the claims. So that is part of what they need to have as part of their job duty, is to enroll in PAVE and become an ORP. And part of their job duties is to review the service authorizations that are set up through our EHR and either approve or deny whether they think it's that fulfills the medical necessity for us to do billing. And also, they provide the services that we provide in the clinics. We also can bill to our managed care plans and to Medi-Cal for those physical exams. And those providers participate in the SMA program. Again, another example of how we reinvest back into providers who actually help our program, as well as bill other programs. So it's a circle of life. Also, we do fund the medical assistants that work in these clinics, and they support the nurse practitioners. And we also have school physicians in those clinics. They support them clinically. And part of their job is when they do have students that come in and they're uninsured, they actually enroll them in the temporary full scope Medi-Cal in the clinics. So then we can then bill those services to Medi-Cal for the exams and immunization administration that is provided. Those medical assistants participate in the SMA program. Along with that, we do fund some clerical staff who maintain the required certification and documentation for the staff and the clinics that is part of running a school-based health clinic. Also, part of this is we do fund some healthcare advocates whose job is to assist students and families with enrollment applications in Medi-Cal and Covered California throughout our district. They also participate in the SMA program, and their full-time job is to do this. Navigators that are located in our school sites, as well as our school-based health clinics, they provide referrals for health services, housing, clothes, food, etc. They assist with enrollment applications in Medi-Cal and Covered California, and they participate in our SMA program. I think earlier the conversation was, how do you know if you have staff who are CHWs or who are wellness coaches? So we have navigators which actually provide those same services that are under those particular service types. We also fund organization facilitators. They manage the MOUs for our no-cost healthcare partners providing Medi-Cal, vision, and dental services in schools and in our well-being centers, and they participate in the SMA program. So again, just they facilitate the no-cost MOUs with these healthcare partners to come onto our different school sites to provide these services as partners with our district. And part of our reinvestments also includes district nursing services. We do fund an administrator who assists the director with the program development of district school nurses, as well as facilitates partnerships with community-based organizations. And also, she is a liaison between Medi-Cal reimbursement and nursing for any new and upcoming things that are developing in the school nursing world. Technical support, we fund a provider, a staff who actually works in the IT for nursing. She provides the nursing enhancement requests and reports as well as service documentation in our EHR. And she also provides trainings around the EHR to nurses every year. And in addition, we fund LVNs who assist our school nurses with diabetic and asthma care, and also the specialized physical health care procedures. And they also participate in ESMA, RMTS, and LEA for billing purposes. Okay, and special education. Special education, we provide them the reimbursement that they request, and they determine how they're going to reinvest it. So one of the areas that they do is, and the staff, of course, they participate in LEA, ESMA, and the RMTS program. They do have staff that provide quality review of service documentation for Medi-Cal as well as special education, making sure that special education is meeting their minutes and time for the special ed students. They do liaison with our Medi-Cal advisors for documentation issues. And the adapted physical education equipment and recreation is part of their inclusion, which they recently reinvested some settlement funds into their Shane's Garden at particular special ed locations, as well as pickleball courts. And this is all around the inclusion part for special education students. They also reinvest in the related services, PD materials and conference attendance. They reinvest in school psych services and early childhood education. And all of this is your PD materials. Also, in our settlements, we have our partners are special education. So we have determined, and the LEA Collaborative has made the determination as well, that 50% of our settlement funds can be provided to special education to fund areas that meet the requirements under the LEA guidelines. And this is some of the reinvestment decisions that they have made. All of this goes through our LEA Collaborative board, and they make the determination on whether the amounts that are being requested, whether they're approved or denied. It is, again, on an annual one-time basis. The only thing that's ongoing is the money that is spent for the administration and operation of the program. Everything else on here needs to be requested every year. And I believe that was the last slide. I don't know if I have any time for questions. If there are any questions, I could answer any.
Yes, there are a few questions, and I can just read those off to you, Margie, if you want to answer a few. I think we have time for maybe 2 to 3 questions.
Sure.
Okay. The first question is, do you have recommendations for the conferences?
Recommendations as in what conferences we attend? Is that?
I'm assuming so. This is from Allison Jacobs. Allison, if you want to clarify, and then I'll just move on to the next question. Which is to understand the scale of LAUSD's LEA BOP program. How many students are in your district? Number of schools, and have you been billing both SPED and general education services to date?
So we have over 400,000 students, and let's see, number of schools, we have over 1,000 schools. And yes, we bill for both special education and general ed services.
Awesome. Anna Simmons asked, can you please talk about the clerical support and documentation and certifications they do? So I think this was similar to that other question.
Sure. So in our school-based health clinics, to maintain those health clinics that have been approved as a school-based health clinic, there are labs like LEA certificates. There are, with our managed care contracts, the providers have to be credentialed, and it's every 3 years, just depending on the managed care plan. So they continuously maintain those certifications and inform those providers when they are going to come up to having their credentialing that needs to be done. They keep track and maintain the database of who remains in compliance, who's coming up for that. They also maintain the policy manuals that changes all the time within a clinic, just depending on the immunizations, depending on the different, I think they do ACEs in those clinics, and they keep up with that and keep track and maintain all of that for the school physician who is the main school physician that runs those or manages those school-based health clinics. So I hope that gave you sort of an idea of what the clerical support does.
Thank you. And Allison, who asked the original question, do you have recommendations for conferences? She did clarify, and she said, yes, you mentioned attending conferences to learn more about Medi-Cal, and I wondered if you had recommendations for these to learn more about Medi-Cal, LEA BOP, and ESMA.
So those in particular are the National Alliance of Medicaid and Education conference that happens annually, and they have a different location every year. You can go on the internet and look for that, where it gives you all of that information. That centers around Medicaid and education for both LEA BOP and ESMA services. Also, the School-Based Health Alliance that just happened in Anaheim, that's a good place for school-based health related items that they do speak about. For instance, the YBHI, they talk about it there. So that's another one. Let me see if I can think of any off the top of my head that are specific to LEA BOP and ESMA.
All right, thanks again, Margie. I would like to introduce our final speaker for the topic of reinvestment of funds from an LEA and consortium perspective, Debbie Connor from Mendocino County Office of Education. And I will pass it over to Debbie now.
Thank you. I'll be discussing how Mendocino County Office of Education leads our LEA BOP billing consortium related to reinvestment of funds. With 23 LEAs participating in our billing consortium, we work to have collaborative engagement to determine how we make LEA BOP reinvestment decisions. This collaboration includes our SELPA Policy Council, which meets on a bi-monthly basis and includes the SELPA Executive Director, LEA Superintendents, a Community Advisory Member, Fiscal Directors, and the LEA BOP Administrator. This meeting is open to the public. We also participate in steering committee meetings. These monthly meetings include special education directors from all of our LEAs, the SELPA Executive Director, the LEA BOP Administrator, a parent representative, and the Community Advisory Member. These meetings are also open to the public. And to complete our annual report and reinvestment considerations, we utilize these collaborative meetings to complete the annual report and statement of commitment to reinvest on behalf of all consortium members. Our LEA BOP management team provides ongoing technical support to partner LEAs to align their expenditures with the reinvestment plans. As the lead LEA, we manage all of the reimbursement responsibilities and follow a detail-oriented distribution model for all LEA BOP interim and CRCS reimbursements. We receive interim payments on a weekly basis. We collect and record the interim payments, review remittance advice detail or RADs from the DHCS provider portal. We reconcile withholds and prior year rate adjustments, all unpaid services, and CRCS adjustments. Monthly, we review Excel RADs provided by our third-party billing vendor. We reconcile the vendor's invoice to our interim payments and build a spreadsheet combining all Excel RADs onto one spreadsheet. We verify which LEA paid for the service providers, verifying details down to the student school level. Annually, after all LEAs have closed their fiscal year, we begin to work on distributing interim reimbursements to our consortium members. We compare our production log to our RAD spreadsheet and then pay interim reimbursements to each LEA that paid the cost of the providers that serve their students, minus program management costs. As the lead LEA, we are responsible to complete one annual report and statement of commitment to reinvest that lists each of our partner LEAs based on prior committee meeting decisions. With help from our third-party billing vendor, we begin working on the CRCS bridging document and CRCS form, utilizing fiscal information from all of our partner LEAs. We get asked a lot, what are the costs to LEAs to participate in an LEA BOP consortium? And how do we cover the cost as the lead LEA in an LEA BOP consortium? First, cost and reimbursement comparison schedule, or CRCS, and prior year adjustments are made to the interim reimbursements based on provider level data if known. And if not known, the adjustments are calculated at the percent of total claims that each LEA earned in the year the adjustment is being made for. So we do a lot of work going back onto prior year records to validate those adjustments. CRCS settlements are either withheld or paid at the LEA's percent of claims for the originating year of service. Our third-party billing vendor costs are shared as a percentage of total reimbursements across all LEAs, and our lead LEA staff costs are determined based on the percent of time each staff member is dedicated to LEA BOP. These costs are then shared amongst all consortium members as a percent of total claims each LEA earned. Costs to LEAs are much lower than if any LEA participated on an individual basis and paid a staff member to manage their LEA BOP program. For our MER and indirect cost rate calculations, we take a weighted average for all of these calculations because all of that, well, that's because that's a rule, but also all LEAs in our consortium have similar MERs. All of them are between 56 to 61%. And the indirect rates are also pretty similar, and therefore any rate variances by taking this weighted average are considered minimal to the overall costs and reimbursements. The Mendocino County Student Health Billing Consortium philosophy is that MCOE provides educational leadership, resources, and services to schools and districts to ensure a wide array of educational opportunities for students. It is the intention of Mendocino County Office of Education to assist LEAs to first serve the student. We then look at billing opportunities for health services that LEAs are already providing that are eligible for reimbursement for from all health insurers. And we work to develop and maintain billing systems that will capture those supports and services. We strive to maintain a sustainable cost recovery system and work to expand service billing opportunities as the need is evident. We recognize that emerging billing systems need to be approached with a growth mindset, and we strive to provide strong structures that will allow utilization of all billing systems at a level that helps to support the needs of our partner LEAs while improving student outcomes. So if anybody has any questions, you're welcome to contact Angela, Hillary, or myself. We're happy to share any of our resources, templates, or any of the information that have helped make this a beneficial program for the LEAs in our county-wide consortium.
Their contact information is listed on the slide. Debbie Connor, Grant Administrator, 707-467-5026. Email dconner@mcoe.us. Hillary Dunn, Fiscal Analyst, 707-467-5042. Email hdunn@mcoe.us. Angela Long, Grant Technician, 707-467-5050. email along@mcoe.us.
All right. Thank you so much, Debbie. Really appreciate your time. We'd also like to give a big thanks for all of our guest speakers today. We really appreciate you being here. And we will now be moving over to the next topic, which is supporting. Oh,
Lacey, it looks like there's one
Yes.
question in the chat real quick, and then we will. So
Oh,
Debbie,
okay.
do you consider individual district MERS in the distribution of funds? How do they decide which district gets which amount?
Oh, well, because all of our MERS are quite consistent across LEAs in our county, we don't use that data to distribute funds. We distribute the funds based on what district or which LEA paid the provider to provide those services. So all of our services are researched down to the student school and also which school paid for the service, because we want to make sure that the reimbursements are shared back to the LEA that incurred the cost of those services.